Good evening, good afternoon, and good morning to our panelists and attendees tuning in from all across the world. Warm greetings to you all on World Heart Day. I am Sandeep Sibal, and I will be your host for this exciting seminar that will explore the connection between exercise and the heart. I'm also the CEO of Fourth Frontier, a 5-year-old company that is committed to helping people with cardiac concerns understand how best to strengthen and protect hearts. Along the way, we've developed a nifty lightweight product weighing less than an ounce called the Frontier X that listens intently to the heart and helps answer questions on whether specific exercises and lifestyle choices are helping or harming the heart. And much of this feedback is provided in real time. Some of you are Frontier X users dialing in, and I extend a special welcome to you all. We have an exciting lineup of speakers for you tonight from around the world, ranging from elite and amateur endurance athletes to doctors and cardiologists who are at the top of their game. Our first speaker is Paula Radcliffe, who I don't believe needs an introduction. She is a former world champion in the marathon, half marathon, and cross-country categories. She's a 3-time winner of the London Marathon, 3-time New York Marathon champion, and 2002 Chicago Marathon winner. She was previously the fastest female marathoner of all time and held that record for well over a decade. Welcome, Paula.
Thank you. Hello, everyone.
Our second speaker is Dr. Aashish Contractor. He's director of the Department of Rehab Medicine and Sports Medicine at Sir H.N. Reliance Foundation Hospital in Mumbai. He was the medical director for the Standard Chartered Mumbai Marathon from 2004 to 2014. He was also head of preventive cardiology and rehab at the Asian Heart Institute. He is vice chairman of the ICCPR, I think I got that right, the International Council of Cardiovascular Prevention and Rehabilitation, and a governing council member of the National Society for Prevention of Heart Disease and Rehab. Finally, he's also the author of the book, The Heart Truth. Welcome, Dr. Aashish.
Thank you. Lovely to be here.
Our third speaker is Dr. Fabricio Braga. He is the medical director at LPH, Human Performance Lab, Rio de Janeiro. He is a consultant cardiologist at Casa de Saúde, São Jose, Rio de Janeiro. And he's also the chief medical officer of the Brazilian Triathlon Confederation and a member of the Ironman Brazil Safety Committee. Welcome, Dr. Fabricio.
Thank you very much, Sandeep. Hi, everyone.
Our fourth speaker is Howard Dyson. He's a British Army veteran who spent much of his time skydiving. He's an MBA from London Business School and a former investment banker, and now the MD and founder of SatMap Systems, a company that builds and sells outdoor sports GPS devices with digital mapping. He's an avid long-distance cyclist and has ridden the exact route of the Tour de France and a tough 10-day challenge in the Italian Dolomites. In a good non-COVID year, he aims for about 12,000 kilometers riding annually. He was recently diagnosed with a heart condition that gets triggered at elevated heart rates. Welcome, Howard.
Hello all. Thank you, Sandeep.
Our fifth and final speaker is Tim Hutchings. Tim represented Great Britain in the 1984 Olympics at the 5,000 meters and was a world-class runner through the 80s. Since retiring from professional running in 1990, he has accumulated vast knowledge in the world of running and founded his own marathon in 2010, which is now the UK's #2 marathon. Simultaneously, he has been an athletics and road race commentator for over 30 years and is well known the world over in that role. Tim developed AFib in 2016 at the age of 57, but has been treated successfully and still runs, albeit slowly, 3 to 4 times a week. Welcome, Tim.
Thank you, Sandeep. My apologies. Yes, great to be on board. And I do, I should emphasize, I run very slowly these days and love it all the more.
We now begin with the speaker session of the seminar. This will be followed by a Q&A later with the audience. Hi, Paula. Thanks once again for joining us on World Heart Day.
Hi, and thank you.
As someone who is one of the greatest marathoners and endurance sportswomen who has ever lived, what do you believe should be the role of exercise in our lives?
Well, I think that exercise can play a vital role both for psychological health as well as physical health. So many of us turn to exercise and to the form of exercise that suits us most because it makes us feel better. And because we want to help our bodies to be stronger, to be fitter, and to hopefully live a little bit longer as well. So I think those are the main roles. I think outside of that, exercise and sports can teach us a lot of things as well about tuning into our own body, trusting our instincts, just knowing instinctively what is the right thing to do, how hard to push, I think is something that we learn through doing exercise and through doing it with the right backup and support.
Thanks. One of the themes of today's seminar is knowing where and how to draw the line. Do you believe that more is better? Do you think there is a point beyond which it may not be good to ignore what your body is telling you?
Absolutely. I mean, I think that up to a certain point, more is better, but there is definitely a line that we can cross. And I think we need to learn to hear our body when it's telling us it's too much, and not to push too hard, because there is a reason that it's doing that. It's probably a survival mechanism that's been built up in the human body over centuries and centuries. And we need to be able to listen to it. There have been times in my career where I have not been able to finish a race, thankfully not too many, or a training session. But I've never regretted making that decision, if it was a decision, or just at that time not trying to force my body to do something that it didn't feel able to do at that point in time. And I think that is important for long-term health. When I wasn't able to finish the Olympic marathon in Athens, I was devastated at the time and kept going over in my mind, should I have been pushed through it? Should I have forced my body in some way to continue until I actually collapsed? And I received a very moving letter of support from Rob de Castella, a very famous Australian marathon runner, basically saying, I know how you'll be feeling right now, but please don't be too hard on yourself, because there are times when I didn't stop and it did lasting damage to my body. And so that made me look back on it with a little bit of relief that I was able to overrule the competitive instinct side and listen to my body and stop before I did damage to it.
Wow, thanks. On another note, COVID has disrupted our lives over the past 18 to 24 months, and many of us are eager to get back to exercising outdoors once again. How has COVID changed your exercise and running routine?
I think now it's able to get back to previous levels, but during the lockdown periods that we had, it was definitely a case of adapting, being able to do what we could within the rules and within the regulations, and I think probably appreciating it, that time to exercise a little bit more, because it was in a sense freedom, being able to get outside and to run. For me, was my time to kind of escape from all of the stresses of lockdown, the stresses of homeschooling. I had particular stresses when I lost my dad during one of the lockdowns as well. So being able to get out and to use exercise as a pick-me-up and as a way of processing emotions in my head, I think was very, very important. And then I actually did contract COVID in March of this year. And for me then, exercise was absolutely a recovery tool, but I very much combined it with my Frontier X, listening to my body and just going very, very slowly. And in honesty, it was probably at least a month, maybe 5 weeks before I felt completely back to normal running. I was running after 10 days, but very slowly and with the monitor on all the time, just keeping a careful eye on effects, because absolutely heart rate and HRV was one of the first things to react when I realized I had the virus.
Fascinating. Thanks. Some of your fans in the audience, myself included, have begun accumulating streaks of gray. What are the things people need to be more aware of when it comes to exercising as they get older?
I think there are a number of things, and I think it's inevitable. It happens to all of us. As Tim said at the beginning, we probably in our minds would like to run as fast as we used to be able to in our 20s and 30s, but we're not able to now. And I think as you get older, it really is a case of using all the information that is out there that has been built up by the scientists, by the physiologists, and by the medical world, and the devices and the technology such as Frontier X, just to be able to monitor things and to keep an eye on things. I know that certainly as a professional athlete, I did ask a lot of my body. I probably put my heart under strain when I was competing. And so it's reassuring for me now to use that technology to put my Frontier X on and go for a run, and to see that my heart at the moment is okay, and to be able to keep monitoring it. And for me to be able to pass the device on to my mom when she was diagnosed with AF as well, that was invaluable in terms of her being able to keep an eye on the condition, but also to be able to liaise with the live ECG with her cardiologist during lockdowns.
Well, that's so appropriate. I mean, the theme of World Heart Day this year is harnessing the power of digital health to improve awareness, prevention, management of cardiovascular disease. And I think you've already sort of covered that to some extent in terms of how you think of it.
Yeah, absolutely. I mean, I think it's really important to be able to access that technology easily and on the move while we're exercising, because that is when we're concerned about being able to monitor and to get the information from that point while we're exercising. So that the technology has come to that point, I think absolutely harness it, use it, and appreciate it.
Thanks so much, Paula, for those amazing insights into your life and revealing how you think about running and exercise and its relationship with heart health. And of course, the use of technology as an aid. Thanks so much for the insights.
Thank you.
I'd like to invite Dr. Aashish now to give us a talk on the benefits of exercise to the heart, how to optimize exercise for the heart, and where we ought to draw the line. Over to you, Dr. Aashish.
Thank you so much, Sandeep. Could I have the slide deck, please, Keshav? So it's absolutely an honor and a pleasure to be here on World Heart Day with such a fantastic gallery of speakers. Thank you very much for having me here. And Sandeep's kept me on a very tight leash of 10 minutes. I've got a stop clock running in the background, so we'll make sure we'll stick to time. So we're going to talk about exercising with cardiac concerns. Next, please. Okay. Yes, over the next 10 minutes, I'm going to quickly run you through the cardiovascular benefits of exercise, talk a little bit about sudden cardiac death in athletes. This makes the news regularly. What's the right amount of exercise, as the topic says? And let's also talk about a pre-participation evaluation before you get started. Next, please. So to do that, let's take a minute to actually look at the heart and how it functions. The heart essentially is a muscular pump. It's an organ that's in the center of your chest pointing to the left, and its function is to receive blood and to pump blood to the body. That's essentially what it does. Think of the heart as a house which has got 4 chambers, 2 on the top and 2 at the bottom. Now, just as a house has issues with plumbing, has issues with electrical issues, the heart is the same way. In the diagram, you see these arteries or blood vessels running on the surface of the heart. Now, remember, your heart is beating from the time of birth to death. That's roughly 3 billion beats a minute for someone, 3 billion beats over a lifetime, someone who lives approximately 70 to 75 years. And to do that work, the heart also requires blood supply, which comes from these arteries which are running on the surface of the heart. So when there's a blockage in these arteries, that's when we say you've got heart disease or you can potentially have a heart attack. Next, please. So when we look at the cardiovascular benefits of exercise, and this is actually a slide that we normally use at cardiology conferences, but I believe that the audience we're speaking to today is a very, if I may say so, elevated audience. So I wanted to present this slide. We can look at the benefits or the cardiovascular benefits of exercise in 4 broad categories. The first is what we call the anti-atherosclerotic benefits. So atherosclerosis is the formation of the plaque or blockage that happens in your arteries. So exercise helps your cholesterol, blood pressure, reduces fat, increases insulin sensitivity, reduces your sugar, therefore. It's also got what I call anti-ischemic properties. Ischemia is when your heart muscle receives less blood supply and less oxygen. So exercise helps that by improving the coronary blood supply to your heart muscle. Antithrombotic properties. What happens is when you have a heart attack, a thrombus or a plug forms inside your artery. So exercise has what one might call an aspirin-like effect, a blood thinning effect to prevent that thrombus from forming. And lastly, it also has what's called an anti-arrhythmic effect. Arrhythmias are irregular heartbeats, which we'll talk about a bit later, and exercise helps against that as well. Next, please. Okay, so I'm sure Paula will agree with this. They normally say that distance makes the heart grow fonder, but this slide says distance makes the heart grow stronger. The question is how much distance? Next, please. So let's touch briefly on this not very happy topic of sudden cardiac death in athletes. Next, please. This is a painting which was done in representing 500 or rather 490 BC. The gentleman you see in the picture, his name is Philippides. Philippides was a Greek messenger. He ran from a city called Marathon to Athens to announce that the Greeks had defeated the Persians. In 490 BC, you didn't have Instagram or WhatsApp or Facebook to announce such things. The guy had to go on foot. And the distance between Marathon and Athens is exactly 42 kilometers or 26 miles. And therefore, that distance is called a marathon. Legend has it that Philippides gave his message, and that's when he collapsed. So that maybe was the first recorded instance of a collapse with endurance exercise. Next, please. 2,500 years later, this June at the Euro 2020, we saw the Danish footballer Christian Eriksen actually collapse on field, and that was a very, very sad sight. Luckily, he had the team paramedics run across. CPR was started, he was defibrillated, and he survived. So that's the most latest instance we saw of a sudden cardiac arrest happening on field. Next, please. So there are two distinct categories of people who suffer from sudden cardiac arrest. If we divide them into below 35 and above 35. So those below 35, the commonest reason is because of having arrhythmias, irregular heartbeat, which leads to something called ventricular fibrillation and a cardiac arrest. And the most common cause is something called hypertrophic cardiomyopathy. That's when the heart kind of swells up, but it doesn't pump quite strongly enough. That's what happens to people, the younger people. The older folk, when I say older, it could be anyone between over 30, 35 years. The commonest reason is what's called CAD, which stands for coronary artery disease. The very standard blockage in the arteries, what we call as angina, heart attack. That's the commonest reason for sudden events happening in those who are above 35. Other reasons are also there, but CAD is the overwhelmingly common reason. Next, please. Okay, so what's the right amount of exercise that Sandeep had asked earlier? Let's look at that. Next, please. All of you know about the standard exercise prescription and guidelines. And on today's talk, I'm not going to talk too much about the standard guidelines. Maybe in the Q&A, we can address it. But people ask this question, is there a line? So there was a paper published about 3 years ago in a cardiology journal, which they call it the extreme exercise hypothesis. Is there a line? That's what they wanted to see. Next, please. And this is what they hypothesize. On the y-axis, you see the health risk. So obviously, higher the health risk, the worse it is. And on your x-axis, you see what's called your exercise training volume. We know that as you start exercising more and more, you definitely improve your health and you drop your risk of cardiovascular and other diseases. But as Paula said correctly, up to a point, more is better. The question is, where is that point? And you see that dotted line that they're showing out there. So they're wondering whether if you go to the extreme, do you actually increase your risk? Mind you, this is a hypothesis. This has not been proven yet. To be honest, till date, nobody has identified a particular specific line or a cutoff beyond which it's actually harmful to you. Next, please. So what should we do? The next few slides, we'll talk about how do we make sure that you're safe, correct? So this is a standard ECG that we call in the UK or in India electrocardiogram. In the US, they call it an EKG, which is essentially a representation of the electrical activity of your heart. Okay, looking at the heart from different angles. Next, please. And each of the movements, we call them waves, represents a different aspect of your heart functioning. Next, please. So, let me give you a quick sort of 1.5 minute cardiology lesson. As you can see in the upper strip, the heart is beating in a consistent fashion, and then suddenly you have this weird looking pattern above the red lines, right, where the red arrows are. Those are known as extra heartbeats, or the technical word is what's called a premature ventricular contraction. At the bottom, you have a frontier X strip, which is sort of coinciding with the premature ventricular contraction. So that's an abnormal heartbeat. Now, when that happens once in a while, that's completely fine. Next, please. But when these premature ventricular contractions happen in quick succession, that's what we call VTAC, or ventricular tachycardia. The ventricles are the lower chambers of the heart. So when they are beating in this sort of fast, erratic manner, we call it ventricular tachycardia. And if it's not well controlled, it can often lead to a very dangerous, life-threatening rhythm as well. Next, please. Keshav, next slide. Yes. The next commonest heart arrhythmia is known as atrial fibrillation. And to be honest, this is slightly harder to identify. And atrial fibrillation is classically defined as an irregular rhythm. There isn't a set pattern between each heartbeat. Each spike is a heartbeat. And as you can see, the interval is constantly varying. Next, please. Okay, so the last couple of slides, the recommendations of the European Association of Preventive Cardiology for participation in leisure time or competitive sports. I'm just going to run through them very quickly, and maybe we can talk more about it in the Q&A. Next, please, Keshav. Okay, so this is a complicated slide, and don't worry, I'm not going to walk you through all of it. Just we look at 3 categories of people. One is people who are asymptomatic, who don't have chest pain, discomfort, shortness of breath. If they are asymptomatic and they have no history of heart disease, they're usually very low risk and they're eligible to participate in all kinds of activity. Those who are asymptomatic, but they have a history, they should be evaluated by a doctor. They should have the ECG done. They should have a stress test done. And depending on the results, we decide a further course of action. And the last are those who are symptomatic. People who are getting unusual shortness of breath, people who get chest discomfort. They should stop exercise, consult with the doctor, and then only move forward. Next, please. So this is just a picture of our heart disease patients running the Mumbai Marathon. About 100 of them take part every year. Tim sees them, he comes down to give the commentary. They run at various distances from 6K to half marathons to full. So it's perfectly fine to do it, provided you do it in a safe manner. And finally, the last slide, we talk about the conclusions of what we've spoken about. Next, please. The benefits of exercise in the treatment and prevention of heart disease are clearly proven. Fitness confers protective benefits against death and disease. However, it does not provide you immunity. Just because you're fit does not mean you don't need to take care. Regular exercise provides protection against sudden cardiac death during exertion. The safe upper limit of exercise has not been defined, but one does need to take caution at the extreme end. And it's safe and beneficial for those with heart disease to exercise with appropriate precautions. So thanks very much for your time and attention. And I look forward to hearing your Q&A when we get to that session. Thanks so much. Over to you, Sandeep.
Thanks, Dr. Aashish, and thanks for keeping to time. Thanks a lot for that. Thanks for your comprehensive explanation on the benefits of exercise, where to draw the line. And I think in particular, the way you simplified the world of cardiovascular medicine for our listeners, that was amazing. I do want to point out that the below 35 and the above 35 categories, below 35 being determined by rhythm changes and above 35 by coronary artery disease, both these causes of sudden cardiac death that you mentioned actually can be picked up to an extent, with the rhythm changes and the ST changes, that can be seen on the Frontier-X. So that's actually reassuring. Thank you. I'd now like to invite Dr. Fabricio to tell us about real-life examples and case studies of 3 athletes from the world of cycling and soccer, and the very interesting case of the athlete returning from a bout of COVID. Over to you, Dr. Fabricio.
Hello, everyone. Thank you, Sandeep, and all the Pro Frontier team, my friend Peter, Manav. It's a huge pleasure to be here to share with you our experience using Frontier-X to survey on different types of cardiac disease patients. We have been using a lot of this data for clinical decision making, aiming at improving athletic and non-athletic cardiac patients, either for diagnostic, treatment adjustment, or prognostic proposal, and ultimately reassuring the returning or even beginning on sport participation. I have no disclosure with this presentation and try to optimize my 10 minutes. Let me jump as fast as I can to my first case. He's a 47-year-old male, competitive amateur cyclist since his late 20s. And despite being a non-professional athlete, he collected some important sport achievement, like the first place in Brazilian edition of L'Etape du Tour. I'm saying this just to put you in perspective how important was sport in his life. But in December 2016, he felt the first episode of tachycardia during a bike ride. These events start to relapse and last longer and longer. And after the 4th episode, he sought medical attention. And even after a normal, totally normal 7 days routine and an exercise test, as the symptoms were relapsing and becoming longer and longer, and the last one reaching more than 50 minutes, he agreed to undergo electrophysiological study where a pulmonary vein isolation treatment supposed to treat atrial fibrillation was performed. After some time, he was released to psych again, but the symptoms recur after his first ride. He was totally struggling to keep cycling because he was feeling tachycardia, and most of the time, immediately after he pushing hard, as after a steep mountain climb or a breakaway over. And one of the things that he highlighted me when we first met, that he was seriously thinking about quitting cycling, despite of all the love, all the passion that he has for cycling. Because of the symptoms, he was really thinking about quitting cycling. At that time, he had just finished a 14 days Holter monitor resistance that was completely non-diagnosed again. And we decided to order a full cardiac routine to rule out structural heart disease and decrease the odds of ventricular arrhythmia. And after that, we decided to put him on Frontier-X and release him to ride. And after 2 months using Frontier-X, the symptoms appeared again. After more than 90 minutes riding, he started feeling a palpitation, which means at that time, stop cycling. And let's see what happened. Here's the heart rate tachogram. And we can see here in the middle of the training, a heart rate spike. This would be the sole information we'd have using a regular heart rate monitor. As a sports cardiologist, it's quite common. Patient arrive in my office showing me heart rate tachogram during the training with a heart rate spike, and always wonder if this is a heart problem or this is an artifact. We already discussed this. But Frontier-X allow us giving more information, that is the ECG recorder. And let's take a look what happened with the ECG recorder. You can see here up here a physiological sinus tachycardia, and then suddenly a supraventricular premotor beat that trigger a supraventricular tachycardia lasting for more than a minute, with heart rate ranging between 192 and 200 and 202, and spontaneously reversing to sinus rhythm. So the diagnosis was done using Frontier X, and he was scheduled for a new electrophysiological study where a dual AV node pathway, the anatomic condition, the physiological, pathophysiological condition that allow patients to do this kind of arrhythmia. This arrhythmia, the supraventricular tachycardia, was induced during the procedure, and at the same procedure, the slow pathway ablation was performed, and now he's completely asymptomatic since then, and now bike riding seriously. So my second case is a little bit different, a different sport. The first sport in my country, in Brazil, is a 44-year-old male that was a juvenile competitive soccer player until his early 20s. And after giving up a professional career as a soccer player, he kept a recreational soccer practice, playing 3 times a week at least for the last 10 years. But in February 2021, he starts feeling a chest pain during a soccer match. He was sent to the hospital with acute myocardial infarction. He was diagnosed, and he underwent a successful primary angioplasty with a stent of the left anterior descendant. But as he had other obstructive arteries, he was scheduled for a second time angioplasty. But that time, unfortunately, the attempt to recanalization the other arteries that was blocked, the right coronary artery, was not well succeed. So he was very well referred to a cardiac rehabilitation program in our service, willing to one day, of course, return to his sport. At that time, he was in full anti-ischemic therapy. All the drugs that we used to give to patients to treat ischemic heart disease was prescribed, but he felt he complains about the beta blockers, making him refuse to keep on it. During the training sessions, he never complained about chest pain, but we are a little bit concerned about the presence of a condition called a silent ischemia, when you have ischemia in the heart, but you do not have symptoms. And we use it to surveil him during the training, use the Frontier X. And here you can see 2 tendon charts. The top one's the heart rate, and the bottom one is the cardiac strength. Cardiac strength essentially represents displacement of the ECG ST segment. This is the part that Dr. Aashish already told about this. ST segment is the part of ECG where we used to look for the presence of ischemia. An upward displacement in cardiac strain, in the cardiac strain line, denotes an ST segment down low, so the presence of ischemia. Let's see what happened here. In the first 80 minutes of training, running at 6.3 miles per hour for heart rate of 110 beats per minute, his SEG was totally normal. For those who are not used to ECG, trust me, this is a totally normal ECG. But in cardiac strain, you can see cardiac strain here, completely normal, stay in this blue line, blue strip here. That means the ST, there's no ST displacement. But now look what happened when he increases the treadmill speed to 8 miles per hour. When the heart rate increase reaching 156 beats per minute, cardiac strain line starts to rise, and we will see here an ST segment downsloping, documenting the presence of silent ischemia. So what we have done, we recommended the beta blocker reintroduction, the drug that will reduce the heart rate and try to avoid those ischemic episodes. And you can see here, after ideal adjustment, he running at the same speed, 8 miles per hour, now with a slower heart rate, 140 beats, and again, no sign of ECG ischemia. But the last slide is very, very interesting. This is a more recent ECG recording, and you can see here a very good example of exercise-induced ischemic precondition, how exercise could reduce the burden of ischemia, even in patients who are not candidated for full revascularization. This is a very long time, no mechanism of exercise performance improvement in ischemic heart disease patients, and proven benefits in terms of sport performance as well for a lot of sports, swimming, running, cycling, rower. And this man, despite, as I said, despite not being a candidate for complex coronary revascularization, now you can see after some type of cardiac rehabilitation, he again running at the reaching the 156 beats per minute, a previous ischemic exercise intensity, but now not showing any ECG signs of ischemia. This is very, very interesting. And this is my last case. In my last case, I'd like to illustrate how we have been using Frontier X to aid post-COVID-19 patients to get back on track. Here we have a 57-year-old male amateur cyclist with a whole life of sport participation. I was a little bit quite ambitious in terms of performance, but in October 2020, he developed a mild COVID. And I put mild into quotes because despite not having been hospitalized, he became very, very symptomatic, including almost 10 days of fever. But after 4 weeks after disease onset, despite feeling some tiredness, went out for a light bike riding, which he described later that was much more exhausting than it should have been. He sought for medical attention, and at that time he had a totally normal 2D echocardiogram, but a cardiopulmonary exercise test was ordered by his assistant physician. So the CPAP, the cardiopulmonary exercise test, was performed 6 weeks after the disease onset. He had a good cardiopulmonary fitness, as you can see here, by a VO2, 137% of his predicted, but compared to the test done 1 year before, 2019, something new appeared. A concerning ventricular arrhythmia during exercise and recovery phase, as you can see here, some VPBs. And based on this find, he underwent a cardiac MRI, and this MRI showed a myocardial size of myocardial scar consistent with myocarditis. He did not have any signs of myocardial edema, so he was classified as having a healed post-COVID myocarditis. And after we can talk about why I describe this like this, because this is important, that he had a healed myocarditis. So thus, after 7 to 8 weeks of acute disease onset, he started a medical supervised athletic rehabilitation program. We already have enough evidence that traditional cardiac rehabilitation process must be adapted to meet the demands of athletes with heart disease. In this case, we decided to survey all his exercise sessions with our cardiac rehabilitation center using Frontier X. And the ultimate question we face a case like this is, when it will be safe to return to outdoor exercise again? We as a doctor must mitigate the cardiac risk. And one of the things we have to assure is that exercise-induced ventricular arrhythmia has reduced. Here we have a screenshot of his activity dashboard, where you can have a first idea of the amount of rhythm disturbance occur during exercise session. Possible unknown heart rhythm is highlighted here by the yellow color in this pie chart. And here we have this December 2020 panel in the very first beginning of rehabilitation program. You can observe here that almost a quarter of his training, a rhythm disturber could be seen. Now let's compare what happened later in July 2021. We can see a dramatic decrease in the arrhythmic burden, as we call the amount of arrhythmia the patient do during exercise. And when you deeply investigate the ECG recorder, you can confirm what was previously suggested by the dashboard. Look into the number of mark of rhythmic disturbance abnormality, the rhythm abnormalities in December 2020. Here, look at the number. They are all actually ventricular premature beat, as you can see here, with the July 2021 dramatically reducing. So scrolling the ECG records in case like this, looking for signs of concerning life-threatening arrhythmia, really reassuring in our return to play decision. And this is my last slide, and and being here, it could be possibly miss the opportunity to say thank you, Paula. Thank you very much. It's very touching for me, not only for all sport achievement, but to lend your incredible physiology to science, as you can see in this Professor Under Jonas paper, and bringing so many contributions in this knowledge domain. As a sportive and exercise enthusiast, I would really like to thank you from the deep of my heart on behalf of all Brazilian sports science and medicine community. Thank you very much. And thank you very much for everyone.
Thank you, Dr. Fabricio. That was absolutely riveting. And thanks for making that connection between exercise and heart health so real for all of us, and the fascinating stories of these three athletes. I have a bunch of follow-on questions, but I'll hold them for later. I'd now like to invite Howard Dyson, who is also a power user and has really taken the use of technology for monitoring and managing his heart health to another level. Over to you, Howard.
Thank you, Sandeep. Can you hear me okay? Is that volume okay?
Yep.
Well, happy World Heart Day, everybody. The team at Fourth Frontier asked me to say a few words from the perspective of a reasonably active tech enthusiast who's currently working through a heart condition, which is having a major impact on an active lifestyle. So I'll give you the background. During my early years in the Army, which included armored vehicles and the special forces, we were expected to push extremely hard during training. Then when we're totally exhausted, get up, do it all again and push even harder. There was a little concept in those days of pushing too hard. I then had a spell on a training floor in the City of London, much of the time pushing nothing less strenuous or nothing more strenuous than a Lotus 1-2-3 spreadsheet. About 15 years ago, I was lucky enough to be able, with my brother-in-law, to start up my own tech company, designing and manufacturing sports GPS mapping devices. That's where I discovered my current passion, which is riding push bikes with friends and family up the wonderful and often steep mountains of Europe. So I think we've got a slide coming up in a second. So for me, it's really all about family, all about friends and the mountains. Some of my best moments have been doing Land's End to John O'Groats. I think that was 1,400 kilometers. And on one occasion, the entire route of the Tour de France for an outstanding charity. I think that was 3 weeks, 3,600 kilometers and lots of hills. So that was all fine until I began to notice at the top of some of the mountains, my regular heart rate monitor from a well-known brand just stopped working for about 5 or 10 minutes at a time. And so I was either suffering from a lot of flat batteries or there was something else going on. I then found an outstanding cardiologist in the shape of Professor Sanjay Sharma from St. George's Hospital in London. And Sanjay gave me a nod in the direction of Frontier X. And really the whole experience since then has been a total game changer. And I'll tell you why. So the Frontier X, I've been using it for the last 5 months or so, has just given me an incredible level of clarity and detail about my heart during these prolonged endurance events. And it just can't get that type of detail from other devices. And it helps me, particularly with this condition, to sort of dispel fear and the uncertainty, especially those sort of flatline situations that we see on TV shows occasionally. And it transpires, I have a condition which you are now familiar with called ventricular tachycardia. In my particular case, it appears to be caused by a third spark plug in the heart, which is deciding to join the party when my heart beat reaches about 150 beats a minute. And more recently, even lower than that. The heart sort of has 2 spark plugs and lots of backup systems, but it certainly doesn't need a third one playing by its own rules. So on the slide that's just about to come up, you'll be familiar with the traces now from the Frontier X. You can see fairly obviously, and you just do not need to be a total expert in this, the graph at the top where the red arrow is, you can see the total change of rhythm, where it goes from normal sinus rhythm into basically a mess, which is a technical term, otherwise known as VTs. Actually, it looks more scary on the graph than it is for me in reality, as there are different types of VTs, and some of them are more serious than others. But the nice folks in white coats did keep saying to me that best we minimize that as much as possible. So I'm fairly sure that the COVID-19 lockdown and all the ensuing restrictions has led to a deterioration in that condition. And at one point, my VTs were kicking in at about 130 beats a minute. And on one occasion, again, it lasted for about 25 minutes. So I guess that was a real low point in many respects. And I realized in my early 60s that effectively my riding days with friends and family were virtually over. Since for me, any decent hill would take my heart rate to at least 155 or 160. Then I got enrolled in the Fourth Frontier heart rate program, which along with the Frontier X unit has made a huge difference in managing the condition. Peter and his cardiac team give me 30 minutes a week of detailed reviews and advice focused on critical aspects of the fitness and endurance training, all within the constraints imposed by my particular condition. I should stress that my cardiologist, Professor Sharma, remains in charge of the medical aspects, whilst the heart program team gives me very detailed and tailored advice about the fitness and recovery. So this, in my view, is where Frontier X is leading the pack with this type of tech. The strap, which is less cumbersome than most other heart rate straps, can easily be set to alert at predefined levels of heart strain, heart rate, and respiration rate. The data then all gets uploaded for analysis later on. Just a word about heart strain. In my view, this is a key metric coming out of the Frontier X strap. And my hope is that this heart strain number will be widely adopted by the fitness industry in the near future. On that graph on the slide, you can see the elevated levels of heart strain, which are marked in red, the fourth graph down. And at that stage, my heart strap was buzzing in a most persistent way, encouraging me to slow down and get my heart back into normal sinus rhythm. So what's the prognosis? Well, in a word, things are looking up. I'm on a low dose of beta blockers, which for me is an amazing drug. And Peter is putting me through a lot of steady base training at about a 120 to 130 beats a minute. For me, this has been a big change, as previously I'd be doing 3 to 4 hours at 150 or 160 with my local bike club, cycling club each week. So after a session, we'll export all the data from the Frontier X and my other gadgets up onto Strava and Training Peaks. So us roadies tend to focus on power output and heart rate quite a lot. And I'm very pleased to say that after the training sessions of the last number of months, my power output for a given heart rate has benefited considerably from this style of training, not to mention keeping the VTs at bay. I'm now back doing 160 kilometer endurance rides, albeit solo and albeit at a steady pace at the moment, and just yet no team riding. And I still need to drop about 20 pounds, but that's in hand. I'm hoping to get the miscreant cells sorted out with an ablation procedure in a couple of months. And then for 2022, it should just really be one question. Next trip to the mountains, is it going to be the Pyrenees or the Alps? So the last item I'd like to mention is about tech, data integration, and how supportive the team at Fourth Frontier have been. This speaks, I believe, to a strong desire to push forward this type of tech to as wide an audience as possible to improve our overall health outcomes and especially cardiac health. After pestering them endlessly about the various aspects of the Frontier X device, they kindly allowed us to export their proprietary data onto our GPS mapping smartphone app. I think there's a screenshot coming up just now. So my firm specializes in GPS gadgets and high quality mapping. It was therefore logical pairing to bring the Frontier X cardiac data out on a Bluetooth connection and display it alongside the mapping, the elevation, and the other fitness data. For us, this gives us a one-stop solution for outdoor hikers and bikers. And on this slide, you can see that we have at the top live streamed ECG above the elevation data and above the mapping data. And we happen to be using, in the UK, Ordnance Survey mapping or some other detailed topographic mapping. I have a particular interest to see live ECG during exercise, as it helps me detect any early signs of VTs. And it shows very, very clearly when my heart goes back into sinus rhythm after I slow down and stop. And that's a really crucial element for me. And at the same time, though, I need to see the detailed mapping as I'm often riding long distances solo. So I've got to navigate and keep an eye on the VTs at the same time, just at the moment. And then after the event, it's then an easy step to export this lot to Strava and Training Peaks, which displays all the fitness metrics, as well as then seeing all the detailed ECG analysis on Fourth Frontier's excellent web app dashboard. So I'd summarize saying that I probably trained too hard when I was young. I got fat, I lost fitness doing a desk job in the city. And clearly these heart conditions can creep up on us unexpectedly, especially after all the pressures of the current pandemic. This type of tech, in my opinion, is a game changer. And it gives us, the average Joe, real clarity over managing these issues safely and successfully. So for which I am eternally grateful. So that's about it from me. Back over to you, Sandeep. Thank you.
Well, amazing. Thanks, Howard, for that absolutely fascinating talk. And, putting the GPS along with the ECG together, some of us call it the inner GPS, in such an integrated fashion is really very novel. We're running a little bit behind time, so I'm going to try and speed things up. Not a heart rate, just the program. And I'd now like to invite our final speaker for the seminar, Tim Hutchings. Hello, Tim.
Sandeep, hello. Thank you very much indeed. My head is spinning because so much information has come at us over the last 45 minutes or so. And so much of it was familiar, almost making me shiver with memories of my experience of having atrial fibrillation over the last 5 years. And I can go back to my younger years as a sportsman, where I trained much too hard, probably from the age of 15 to about 25. I was with an old coach who was a swashbuckling old school middle distance coach who believed in that more is better. And he believed in lots of repetition sessions, short sprints on the track with very little recovery. And if you were feeling absolutely terrible after 15 400s with 30 seconds rest, then his remedy was to do another 5. It was that sort of philosophy. And I don't know why in 2016, at the age of 57, I developed atrial fibrillation, but I've a sneaking feeling it might be a lot to do with probably using 1 billion of my 3 billion heartbeats in those 10 years. I really don't know, but that's my instinct. Even though from the age of 30, when I retired, up to 57, I was absolutely fine. I kept running 3 or 4 times a week in my 40s, 50s, and I thought I was healthy. As an Olympian from 1984, I thought I was bulletproof. I thought I was deserving of all sorts of health privileges that come with being a regular aerobic exerciser. And I guess I had a sort of arrogance that, this can't possibly happen to me. And in 2016, early in 2016, I was jogging along the seafront down here in Brighton in the south of England. And I just felt terrible. I couldn't keep up with people I was running with who were very, very slow and unfit. And I literally had to stop and walk several consecutive runs. And I thought I'd got a virus or I was anemic or something, went to the doctor, got checked out. A couple of doctors later, they said, you've got atrial fibrillation. I had no idea what they were talking about. So I had 2 ablations in 2017, having been to the Rio Olympics and feeling like death warmed up for a couple of weeks with all the charging around in the heat and humidity. A couple of ablations in 2017, which did the trick. Each ablation treated some slightly different element of the bad rhythms in my heart. It's an electrical problem too, by the way, not a plumbing problem. And here I am at 62. I run 3 or 4 times a week for half an hour, very, very slowly. And I have to admit to not being, I'm probably the polar opposite of Howard, who seemed with military precision on top of his cycling and what's going on in his heart and how to use the Frontier X. I tend to go out very often not wearing my Frontier X and just waddle around the lanes around here at a very, very slow tempo, sort of believing I'm keeping below such a safe threshold that I'm not in any danger. When I had my ablations, I was told I could carry on training, I could do weight training, I could pick up old fridges, I could even push broken down cars. The one thing I was advised not to do was to run a marathon. They said you can run a 10K, run a half marathon if you want, but the extreme stress of running a full marathon might tip you over the edge. So I have adhered to that with a margin of error. I haven't done a 10K or a half marathon for years. But the Frontier X, when you first came to me 2.5 years ago, Sandeep, I had no idea what you were talking about. I'm not a techie, but I absolutely can get my head around it. And I wish it had been around when I was younger. I think it's probably something that every 5-year-old child should be made to wear for a day, just to get an idea of their heart rhythms and check them out, make sure they are not that tiny percentage of people with a heart abnormality of some sort of fairly basic level. And if I was in an appropriate situation, it's a gift I would love to buy my father, because it is so much more valuable than an iPad. It's something that essentially doesn't guarantee health, it doesn't guarantee life, but it guarantees you are pretty much on top of your own health, your own heart, and what it's doing when you're exercising, and actually 24/7 if you want to wear it for that amount of time. So in all my years since retiring at the age of 30, so that's well over 30 years now, and all the technologies that have come in, because of course when I was running in the 80s, there was no internet, there were no mobile phones, it was prehistoric era compared with the one we're in now. This is the most astonishing device that can be worn by anybody, that is affordable to just about anybody, that gives the most critical data you can get. We all get sore feet, we get verrucas, we get injured Achilles, we get sore calves, we get sore muscles all over the place. But there's one muscle that is more critical than any other by thousands of percent. And the Frontier X is the device that can manage that one muscle in the middle of your chest. So I'm delighted that the company is going places. And Sandeep, you know, I know you and the team have been through a hell of a time the last 18 months, like all of us here, all the panelists, I'm sure just about everybody attending. But well done for coming out the other side of it. And I know that the device is getting better and better and is still unique.
Thank you. It was very encouraging and supportive comments. We have actually come out the other end stronger. And a lot of things about you that I didn't know, now I do. I'm going to be just cutting some of this a little short, if you don't mind, just rushing through. It's 10:30 already. Here in India, it's 1 hour. And we've got a ton of questions. We've got, I can see it's just kind of over 60 questions, which obviously we can't answer. But just to do justice to the audience, I'm going to cut some of the other stuff a little short, if that's okay, and rush to the Q&A. I'll just give one little piece, maybe a confession from my side. And that is that the day after we launched the Frontier X at the New York Marathon, November 2019, and Tim, you were there, we had a post-launch party. I had a few glasses of wine, followed by poor sleep, followed by back-to-back business meetings early morning with nothing but 2 mugs of coffee. And the Frontier X gave me a buzz as well. And a few hours later at Mount Sinai in Manhattan, they did find out that my ticker too had gone a bit haywire. And I realized it's not just about exercise in the heart, it's also about lifestyle. No permanent harm done, but it did tell me that lifestyle choices, imbibing alcohol, poor sleep, a busy day powered by caffeine on an empty stomach, is not good for the heart, at least not mine. Now, to explore that connection between lifestyle and the heart, we've just released a new feature that lets our users tag various health events so they can see for themselves the impact that these lifestyle choices have on their hearts. Every heart is unique, and this is to empower each of us to understand what's good for us. Now, this seminar is about understanding the connection between exercise and the heart. We plan to have a follow-on seminar in the next quarter to explore the connection between lifestyle and the heart, alcohol, sleep, caffeine, etc. Please keep a lookout for that as well. We are also planning to do some very interesting research in this area, so drop us a line at support@fourthfrontier.com if you're interested. Let's quickly move on to the Q&A with our listeners. Since we're running out of time, we'll only be able to cover a few of them. So I'm just going to start with the very first one, which is a question for Dr. Aashish. I have had a heart attack last November 2020. I'm using the Frontier X in 6 months now. My rehab is going well, and fitness-wise, my workouts are back to 80%. However, the LVEF, as tested last month during stress echo, remains at 35%. Any suggestions on elevating the workouts considering the LVEF percentage? Question mark.
Okay, so let me start by saying that what the advice we're giving on a forum or a platform like this is more generic. For an individual person, I think it's very important to talk to your doctor to understand that. LVEF stands for your left ventricular ejection fraction, and in simple language, it's the pumping capacity of your heart. The normal value is somewhere between 50 to 60, 65%. Normal is not 100. often when people have numbers like 35, they get scared thinking that normal is 100 and we are sort of at 35. Normal is between 50 and 60, you could say. So if it's 35, and that indicates that there could be some temporary or permanent damage to the heart muscle, let me reassure the person asking the question that with a 35% ejection fraction, assuming everything else is fine, you should be able to lead a fairly normal life, an active life. Just because you have a low ejection fraction or lower than normal does not mean you cannot do most activities. Yes, maybe you might not be able to climb Mount Everest, but apart from that, or such activities, you could do most normal activities. And if you speak to your doctor and we gradually sort of observe you and build you up, you could even take part in endurance events under observation. And for such an individual, having their ECG monitored would be even more valuable.
Thank you, Dr. Aashish. Next question, this is for Dr. Fabricio. And I'm picking this one because it's really unique. The questions are on COVID and the heart, but this one's about the vaccine. Here goes. Just recently, I was diagnosed with vaccine-related myocarditis and released from the hospital 2 days ago. My EKG, echo, and dye test came back positive. With my echo, it was clear that inflammation was present around the pericardium, so helped put my mind to ease with respect to heart disease. What would you suggest in a return to exercise protocol? When would you start, and in terms of intensity, do you have any guidelines? Thanks so much.
Thank you for the question. So I think the main point is this: returning to play should be surveilled by a experienced physician in treating myocarditis. The problem is the information we have about back to sport after a myocarditis came from very old studies, and most of them based on animal models. And the information we will have that myocarditis exercise during acute phase or subacute phase of exercise during subacute phase or acute phase of a myocarditis episode could trigger arrhythmia and worse the heart function. We are not very sure about this, but this is the information that we have at this moment. So for that reason, it's recommended to wait at least 3 months to get back to exercise. And you have to be sure that you are dealing with a patient with healed myocarditis. This is the example that I showed, that there is no more edema, no acute phase, no only the scar. And after that, the patient should be stratified by the presence of inflammation, and probably they will not have, the presence of a ventricular induced arrhythmia, and then the ventricular function after the episode. Most of the myocarditis cases that I saw for cases by COVID, I didn't see any cases caused by vaccine. I see some caused by the disease. A very small in terms of amount of myocardial, inflamed myocardial. And the patient used to recover well, all of them, except one of my patients now with heart failure, but most of all the others are back in sport. So it's very hard to have a one-size-fits-all answer for patients with so different types of disease. But what I recommend that look for a doctor with a very good experience in terms of myocarditis and follow his recommendation. Okay.
Thank you. Thank you, Dr. Fabricio. Here's another question. As a young man, maybe Dr. Aashish, you could answer this. I was an enthusiastic athlete playing a high standard rugby and teaching PE and working out every day. At university, I had a number of great friends who also were enthusiastic sportsmen. This seems to be very much like Tim, your profile, and perhaps Howard's. Now in my late 60s, I recently suffered a heart attack and learned that all of my sporting friends from university had also suffered from heart conditions that have severely affected their lives. My question is, Is there a correlation between extreme exercise in our youth and heart conditions in later life?
Okay, so that's a very interesting question, Sandeep, and that's something that the world of sports cardiology has been grappling with over the last 5 or 6 years, especially. I'll tell you what's been the sort of consensus as up to this point. They say that when you have a very large volume of exercise, both in terms of the number of hours as well as the intensity, the way Tim described, doing high repetitions, repetition after repetition, that might lead to some amount of scarring on the heart muscle. And that scarring could, again, I'm using the word could, lead to atrial fibrillation later in life. So that's something which could very likely have happened in Tim's case. Something else that they have recently found is that veteran athletes who had a large lifelong volume of exercise often have more what's called calcification in the heart arteries. When you do something called a calcium score, they have a higher calcium score, which ordinarily might indicate more heart disease. But, and this is important, they found that though they had a higher calcium score, they had lower heart attacks compared to sedentary individuals, because the higher calcium led to what are called calcified hard plaques or heart blockages, which did not rupture and cause a heart attack. The plaque is like a volcano. It remains dormant for a long period of time, and one fine day it ruptures. So if we can prevent it from rupturing, then it's fine. And the harder the plaque or the blockage, the lesser chance of it rupturing. So though these lifelong veteran athletes had a higher calcium score, they did not necessarily have higher heart disease. So this is what's sort of known on the subject, and we're still studying more and more. Nobody's defined that what is that cutoff, what is that volume. And my guess is, to some extent, there will be some genetic predisposition to some of this happening as well. I think Dr. Fabricio wants to add something to that.
Guys, I would like to add. So the benefit of exercise is probably 1 trillion times the risk of exercise. I think I have to, this might be clear. There's not a single information, zero scientific information that even Olympians will live less than the general population of their country. By country, there is a lot of information, a lot of paper showing that endurance athlete and Olympian will live more than the general population of the country. Even the fierce complication of atrial fibrillation, there is the stroke. There is not a single information showing that athletes or sportsmen will have more stroke than those who do not exercise. So I think as doctors, I think it might be clear that for sure, if you wrongly exercise, and I think that the most important thing that I used to say to my patients, that if you not respect the resting time, because resting is also training, you could have a serious problem during exercise. But the benefit of exercise overpass by 1,000 any risk that could be caused by it.
Absolutely.
Thank you. We have 70 questions, and I feel terrible that we're not able to answer them. What we're going to do is put this talk and snippets of it on the Frontier Heart Forum. And whoever's asked a question, we're going to try and answer all the questions. Maybe the esteemed panelists could respond to them in written form, because we really are out of time. There's one quick, looks like a yes/no answer for you, Howard. It says, Howard, is what you have called Wolff-Parkinson-White syndrome or something else? Or what is it called?
As far as we're aware at the moment, it's called right ventricle outflow tract tachycardia, which not really totally understanding all this. I think there are some cells near a particular part of my heart which kick off when the adrenaline gets to a certain level, acting as that third spark plug. So it's not as bad as the VTs you saw on the earlier slides. It's not great. You don't want it. You want to get rid of it. But it's not catastrophic, but it's arising from some cells that are doing what they're not supposed to do when the adrenaline gets high.
Thank you. We have run out of time, folks. And but before we finish, I think as a mark of the respect, and the time that our esteemed panelists have spent, I would like to go around the table and have each of them end the seminar with their closing thoughts or key takeaways. Let me first begin with you, Paula. Just your quick thoughts.
Okay, thank you. And thank you to every one of the panelists and the people watching as well. I guess my quick thought would be to once again thank Frontier X and Fourth Frontier for bringing this device. I talked about my mom earlier. She has been part of the same monitoring health program that Howard was, and invaluable in terms of giving her the confidence to keep doing her exercise, to exercise safely while she recovered and went through the treatment for AF. She's just come back from a week's walking holiday, which she built up to with the training that she was advised on by Peter. So thank you very much for that. And I would heartily recommend it to anybody who just has questions and wants that confidence to be able to exercise safely and look after their heart.
Thank you, Paula. Just for the clarification of all our listeners, the one program that Paula mentioned and that Howard's also part of is called the Frontier Heart Program. It's actually a service offering that's layered on top of the product. If you'd like to know more, there's information available on our website, or you could just reach us at support at Fourth Frontier and we'll get back to you. Thanks, Paula. Over to you, Dr. Aashish.
So once again, I echo Paula. Thanks, everyone. I think the important take-home message for everybody is that exercise is fantastic for you. We all need to exercise. If you have any concerns, please speak to your doctor. Today, technology is available, which can monitor you, which can help you exercise safely, take you to the next level. So make use of the technology if you need it, and take care of your heart.
Thanks, Dr. Aashish. A few words from you, Dr. Fabricio.
First of all, thank you very much to be here. It was such amazing. And I just think that we all have been looking for a more inclusive society in a lot of senses. And I just think that put cardiac patient into sport is one of the inclusion we might do. And we as doctors, as health professionals, should lead this process. We have to cross this frontier. We have to put cardiac patient into sport. Thank you very much.
Thanks. Thank you so much, Dr. Fabricio. Over to you, Howard, for your thoughts.
Yeah, well, thanks very much, everybody. I just say that I think we're going into a very exciting time now where these sensors with Bluetooth connections with mobile phones is bringing this kind of data more to the average person on the bike or running. So I think it's an extremely exciting time, and I rather sneakily suspect there'll be some more sensors further down the road from Frontier X and Fourth Frontier, which will be very exciting. The last point I'd make is I think relating to the previous question about having done a lot of exercise when you're young and what you do when you get into your 60s. And I think it's kind of reiterating some of the things we talked about earlier, is that one's just got to take it carefully, and the rate at which you ramp your training in your 60s, I think needs to be steady. And certainly the Fourth Frontier dashboard tells you about ramp rates for your training. So rest is really important. So train, then rest, and ramp your rate really steadily, and keep a good eye on it with the tech that we've got these days. So I think it's all very exciting.
Thanks, Howard. Tim, you have the last word.
Thank you, Sandeep. Yes, I mean, I heard at the Berlin Marathon at the weekend where I was working, the Sunday just gone, there are now estimated to be 1 billion runners on the planet. Running has boomed during the pandemic. But whether you're a cyclist, a rower, a runner, whatever your aerobic activity, there are various devices out there, but this is the device that you can forget about when you're wearing it. And whether that's during your exercise or during your exercise and then for another 12 or 15 hours, this thing is recording away and taking the readings going on. So for those billion runners, it is, I would recommend it. I also think it's important to point out that for every runner that develops a heart problem like I've got, or that Howard has got from his earlier days as a sportsman. There are unknown hundreds who would have got ill if they had not taken up sport and aerobic activity. And you can never quantify that. We don't know how many people would have dropped dead in their 30s, 40s, and 50s from a heart attack if they hadn't been aerobic exercisers. So for people who panic and worry about running being bad for you or aerobic exercise being bad for you, it's absolutely not. It's, as Fabricio said, Dr. Fabricio said, it's hundreds of times more beneficial to be an exerciser than to be sedentary. We just don't know how many hundred times. But I don't want to scare people by saying I trained hard and got lots of exercise and I've got a heart problem.
Thanks for the balancing thought, Tim. Well, thanks everyone for attending, and I hope you enjoyed this seminar as much as I did. Once again, a very happy World Heart Day to you all. Stay healthy. Thank you.